No. Hello, everybody. Welcome to the April 10th, 2025 Board of Commissioners meeting. This is where we're starting with our 1 p.m. meeting. And I'd like to call the meeting to order. Start with the Pledge of Allegiance, and I'll ask former Commissioner Coyle to lead the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay.
You remembered it.
Well, first in attendance to arrive and leave is former Commissioner Coyle. We also, in the room today, we have all three commissioners. We have Allison Silverkowski, we have Jason Henry, Chantal Deponin, Keith Gates, Chuck Nickerson, and Layla Matilla. In Zoom land, we have Sheriff Macias. It looks like Rich Sawyer and Aaron Poker are also on Zoom, Pat Conway and Katie Casey. So we have a fairly lengthy, a lot of reading today for Commissioner Tamburello.
Looking at that going.
Hopefully he had his Wheaties for breakfast and lunch, and we'll jump into the RFP openings and awards.
Make a motion to authorize the senior director of facility planning and IT to review, evaluate proposals, and return with a recommendation. Second.
Any discussion? Hearing none on the motion, Commissioner Commissioner Godu. Wow. That was the last one. Commissioner Tamburello.
Commissioner Godu votes yes.
Wow, that was a bring us elsewhere. Award. We have award for professional auditing system services.
I would make a motion to approve the proposal for professional auditing services to Basham, Lucky, and company for PC for fiscal year engagement 2025 through 2028 with a total base fees being $224,450 as recommended by the senior director of finance. Second.
Any discussion? I can only like to add that this was the lowest bid, and they do have experience working with government. Did you?
Yeah, by far and away, like $100,000 difference. And it's not at all because they're cheap. They're very well experienced in the government sector, especially in New Hampshire. Excellent.
On the motion, Commissioner Tamburello.
Yes.
Commissioner Godu.
Yes.
And I vote yes. Next, we have payroll approval.
Now make a motion to approve the payroll expenses in the amount of $1,520,168.91 for the period ending April 5th, 2025. Second.
Any discussion? Just on par with what we've been seeing for the last 4 or 5 pay periods. Like to see that we have some consistency with that. On the motion, Commissioner Godu.
Yes.
Commissioner Tamburello.
Yes.
And I vote yes. Next, we have commissioners' updates. Anybody have updates?
We've reached temporary agreements with the sheriff deputies and with the dispatch. I think that concludes all, we at least have temporary agreements with all those unions right now. So we're moving forward. We'll be able to plug that into the budget.
Mr. Tamburello?
Yes, no.
Okay.
I was gonna say yes on the motion, but it wasn't a motion, but no. No.
Okay. I guess, you know, we're working through budgets today. The only thing I'd like to say, and I think I speak for everyone when I say thank you to all the department heads and all the departments for working so hard to put together best budgets you can. I mean, it's just a really difficult time for everybody, and we recognize that you're, you know, experiencing increases too, and we're obviously looking at the budget as a whole for the county, but we appreciate all the efforts that you've made in your budget proposals, and that will continue. And hopefully we will conclude round 1 of some are one and done, some will be coming back, but hopefully we'll get a good round one done today by the end of the day, so. Moving on, we have the discussion of, ICE enforcement discussion. Do you wanna take it away, Commissioner?
I'll lead off. Um. I believe we have a commitment to fully investigate this situation. There's been all numbers thrown out there of how much revenue the county is going to get, potentially could get. But we don't know what our expenses are, and it's a lengthy process. We have, I saw the forms come over. Jason, Henry shared the forms that there's like 17 documents to fill out, one's an agreement, but there's, typical government kind of thing. But through that process, I see that that's how we will come to a conclusion, what the financial aspects and probably some of the circumstantial aspects of taking ICE detainees in. So with that, I would like to move that and this is an official motion.
Yeah.
That we authorize Jason to fill out the paperwork and collect all the numbers. And I know Chuck there's financial stuff that he's gonna have to do to plug in there. And so that we can just move it forward and learn what we need to learn so we can make an informed decision.
I haven't seen the RFP, so, I mean, in terms of like, having a formal motion, would it make sense to have that, have that next week so we can get the backup to?
That's all you gotta see now.
Well, okay, so
I didn't get the.
I'd like to clarify, the most important part in the RFP to us is how much you're gonna pay us to house, what's the revenue stream gonna look like coming in? And the way this RFP is kind of set up, they've proposed to us to fill out all of the paperwork that has to do with our financial operating expenses. And then they will come and discuss how much they would potentially give us. So I think it's appropriate to just authorize Jason to get the ball rolling. I don't see any, it wouldn't be helpful. There's nothing else to delay. There's the numbers that we would like to see, we're not gonna have until they put it together.
I just worked on it.
Okay, so I did not receive the RFP.
My
And
apologies.
so,
Oh, so you did.
I meant it when I said I hadn't received it. I would like to put this off just a week, so I can look at it. I haven't seen it. We're up for discussion. And so I don't really feel comfortable. I just want a time to review it.
Okay, so there was an apparent deadline of April 21 to complete the application. Jason, can you kind of weigh in on how strict that deadline is, or, is waiting a week going to be significant in the process?
I don't think so. I mean, the deadline was, I can ask them to move the deadline. It's all this is an RFP for us to collect data and give it to them, and the negotiations don't start till after you fill out all the RFP stuff. It's not negotiations. It's to give them all the information, then they come back to you with what their thoughts are, and then you guys still have to go back for negotiations, and then at the end, you still have to decide if you want to do a contract with them. So I even at this point have to ask them to move submitting the RFP back to them. Will still have to be pushed either way.
So,
Well, I do think that you should see.
yeah, I would, if
Read.
you're okay, I'd just like to read the RFP to know what we're dealing with. I mean, I just have, yeah, so,
And the other thing is, I sent Jason, for 6, I thought good questions
yeah,
that I sent to the label, so I think the RFP is gonna answer some of them. I'm good to go forward, I'm good if the time works to hold it off, I'm going to, Commissioner, will get a chance to look at it. But I'm definitely gonna support that we go forward with the RFP, because I wanna know enough about ICE, and when somebody asks me, I can give them the right answer. Right now, I'm guessing at the monies, I'm guessing how safe it is, I'm guessing at all 6 questions that I gave to Leila to give to Jason, I believe, so. I support that aspect of it, and if we get it and it doesn't look right, we did our due diligence and we rip it up. And we walk away.
We're not gonna find out what it's all about until we do all the paperwork.
I just want.
All of our questions. No, you should, I thought you saw it already.
No, I sent to her husband, that's my fault.
No, it's just like, the problem is everybody else's pay first initial, full last name. And because that was already it's not your fault, it's like it already, that's a email address that was already in the system.
Oh.
They had.
Oh, from good old, what's his name?
I saw Gabe, but I didn't see that, yeah.
So that,
I've done it too.
it's
It's not
happened
the
to
first one.
everyone.
Well, maybe we wanna
It's
get-
happened to everyone. I'm gonna do my whole first name because.
Don't back and look.
All right,
Just
so
like-
I'm okay with delaying it till next week, where there's no consequence, you should read it before,
Okay.
or at least take a look at the 17 documents that they were asking us to fill out.
But if we do submit it, do we have, I just wanna see what it is, what we're committing to by submitting, it just.
We're not committing to anything.
Well,
Yeah.
I just-
You don't know that. Right, fair enough.
Okay.
Can I at least start gathering the data?
Well, I mean, if you wanna gather data on I don't think there's.
I think that's wise.
Okay, it's just a lot of data gathering on my end, I just rather start working on the data. You say you don't want to do it, that's fine, I don't care, but really get a chunk of it, it's a lot of data.
It's a lot, they're asking for lots
And
of
some of the
information, way
questions-
more than I thought.
Some of the questions, Jason, can we ask them now? I know they don't wanna do it in a public forum, but the questions that I came up with, can we get those answers?
Yeah, when I get the questions from Leila, all of them,
I don't know,
I think
you
we'll wait
guys
for one
give
more
me
person.
I have some questions,
Yeah.
Yeah.
I'm the
As soon as I get them, and some I can already answer, I believe some of them.
You're working on
them.
I can get your answers, that's
Some
not a
of them you
problem.
might know.
Yeah, I can get the
And
answers.
like the budget.
As soon as I get it.
And I read.
Okay,
Busy.
that's good.
Okay, so we're gonna move on to, right contract with the Department of Corrections, female housing agreement with Merrimack and Carroll County DOC.
Make a motion to approve the female prison and housing agreement with Merrimack County Departments of Corrections and Carroll County Department of Corrections pursuant to New Hampshire RSA 31-B:21 for the period beginning July 1st, 2025 for 1 year term as recommended by the superintendent.
Second,
Discussion,
Is Merrimack 1 year and Carroll open?
Carroll is, I believe, open.
Merrimack's the only one usually doesn't open, just wants to do 1 year, Carroll leaves it open.
Yeah, it's good cause for 30 days. So you, 30 days written notice to turn in.
The price,
We're tenants at will.
my only question is, do we have similar agreements with other counties, or we only use these two? All the other counties we have agreements with, yeah,
So,
that's good.
no,
Some, not all.
Oh, not all.
Not all, because some will just do, they don't, it's just a transfer at no cost because we don't really use them. So it might be back and forth if somebody I can't get
You
to
don't
house them.
Need
And
to
we have
pay the
one
money
county,
to go to
and
co-ops.
we have one county that we
no.
do not use totally. That's a separate subject at some point. That Superintendent would like to come and present to here at some point, to talk to you guys, but,
Okay.
I
So-
think it's easier to keep it within a couple, because the only problem we could ever have would be the medical billing. I mean, realistically, years ago, we had an issue, I don't even know if you were here at the time, you were at that other Maple Leaf County. But I remember, that's the only problem, you go to too many, because we pay the medical, right?
yes.
So I remember there was a little glitch and we stopped using a couple because of the billing with the medical, we thought there was something.
It's nice, five out of 10 counties all use prime care, but that makes life a lot easier, including the ones that we primarily use, which is also helpful.
But the one consideration, and I think that we have good relationships with Merrimack and Carroll, but there's another factor that is important, I think, which is like for why we don't place as many women in Keene or in Coas or things like that, because family members, in order to visit their loved ones who might be incarcerated, have to travel great distances to the far ends of the county. So
Right.
I appreciate that, these aren't like so close, but they are accustomed to taking our women. They're close enough that families can access those places with relative ease. And the other factor is from a sheriff's department standpoint, if there is transport, that maybe the sheriff's department is only going to, you know, if there's movement to court, like they can take, if we keep them to two facilities, then the sheriff isn't driving all over for one individual as opposed to for court transport.
So,
Those are just other considered.
so out there, so we mainly send to Carroll County. When I was up there superintendent, this is kind of where it started. And when I help create programs like a 9-day house program here, it's really curtailed towards ladies, towards females. So that is helpful. That is a lot of programs specific for females, which is great. The ones we have to keep are on methadone, because nobody has methadone. They have to take them to the street where we can do it inside. Merrimack County, if I need somebody who needs 24-hour medical care, because Carroll does not. And Stratford County sometimes too, because they have 24-hour medical care. So those are the ones we try to use for there. We are currently working with the DEA and state and everything else to do take homes for methadone. So eventually, when you get stabilized out in the community, an individual can get take homes, a 2-week take home of methadone. And jails can get that 2 weeks sent to the jail, they can give it to them and don't have to go out for those 2 weeks. They're working on that for prime care. We'll be able to do that here, become our own distributor and be able to do take homes, because we want to do that for the new community corrections instead of having to go through, create our own OTP program over there and safes and everything else to be able to do that. And we think we can get that through. If that's the case, then the ladies I have here on methadone also could go to the facilities, because they're willing to take them if they have 2-week take homes. We're actively working on that.
One more quick here, one more reason.
Sure.
Are they all still the same price?
Yeah.
They've maintained flat and
No.
they're this,
This is up by $3.
$3.
It was $57.50.
Oh.
It's now $60, small increase. I mean, this was in place. 2013,
Long time.
like 2010 with no increases whatsoever, so a small
That's
incremental,
okay.
a little one.
but we feel, actually, as we have gone through the budgeting process, we feel comfortable that it's good that we're memorializing these agreements with this price, because we know that in terms of budgeting that we're supporting it sufficiently. Okay, any further discussion?
No.
Okay, on the motion, Commissioner Tombrello,
Yes.
Commissioner Godu?
Yes.
And I vote yes. Line item transfer facilities,
I'll make a motion to approve the line item transfer requesting number $41,795 dated April 7th, 2025. Transferring from the delegation contingency to the generator plant purchase services as recommended by the Senior Director of Facility Planning and IT.
Second.
discussion. This is just in pro forma for the delegation in relation to replacement of the breaker, very old breaker switch. So,
I thought it was gonna be more money.
we've got
Yeah,
some-
we made out okay.
Yeah,
Yeah.
It could have been a lot worse.
wow. I thought, yeah, I know, I thought it was gonna be closer to double that, so that was like big one.
Yeah.
Great. Okay, on the motion, Commissioner Godu,
Yes.
Commissioner Tombrello, and I vote yes.
Thank you.
We have the Foundation Seacoast Health Aging Grant application.
Make a motion to authorize the finance and long-term care officers to apply for the Foundation Seacoast Health 2025 Healthy Aging Grant. The amount of $34,339.20, and authorize the Senior Director of Finance to electronically submit the application on behalf of the Board of Commissioners.
Second.
Discussion.
I just like that we're supporting aging health. I like that.
Well, this is musical therapy equipment. It's-
So,
You didn't
there-
get the punchline.
there's a company, it's, they do instruments, like if you think of like parks or museums, you can see them and there's like xylophones and tubes, and they have a line, this company, that's geared towards senior living, and the hope and goal was in our courtyard along the path. I know Jude's team's working closely with Life Enrichment to make it a butterfly certified garden. And then adding music along the path. We bring our residents, especially our dementia residents, out on a walk every day to have something that they can touch. Music studies show with Alzheimer's kind of opens different kind of facets of your brain. And then also you see families out there visiting, and when you have a grandchild or a child, and you know, to be able to either do it together, some of them, or for the child to do it so the grandchild, so the parent can talk to, you know, their loved one. So I reached out to Molly, who's been absolutely wonderful, and asked if anything existed, and she has been like completely on it, and she's done all the legwork, it's been great.
That's awesome.
But the hope being that it would essentially be a music path throughout the courtyard for,
That is so cool. And
Yeah.
like the butterfly garden, I mean, that sounds so like just lovely and what a nice like, just like garden space for the.
How big is that gonna be?
how big is
The
the,
garden?
I don't know a whole lot about that piece. There's certain plants
I'll
that
tell
you
what,
need that
history will
attract.
show My hometown of Sandown, the garden club came and asked us for the butterfly thing in town hall. We didn't know they took over the whole front yard of town hall.
So I think it's just I think it's certain plants that are.
It is specific
Yeah.
plans
Yeah.
for the
Pollinate.
certification.
No.
And I do think there may be a few down at the old, Master Gardeners, some more mature butterfly bushes, et cetera, that we might be able to transplant up as well.
That's not,
Yeah,
it's
Very
pretty
cool.
Safe on cut the
Yeah.
lawn.
Julie knows a lot about butterflies.
Yeah,
too.
Julie and I have talked about it.
We get the
Well into
butterflies
it.
and we
Yeah,
hatch them,
totally.
we let them out in the
And thank-
courtyard every year.
The other thing is
Julie and I
like,
are the crunchies.
Yeah. Thanks to Molly, because I mean, this is something we'd love to implement. We're under budget price, crunch. And so it's really nice that we can get grant funds to do these special things and it's not hitting the bottom line either, so that's wonderful. Okay.
Molly's been fabulous, truly.
On the motion, anyone else? The motion, Commissioner Tombrilla?
Yes.
Commissioner Godu?
Yes.
And I vote yes.
Thank you.
We have a change order request for Pitney Bowes in the delegation office.
I'll make a motion to approve the change order request for Pitney Bowes for an additional posted meeting for the delegation coordinator from amount not to exceed $1,146.36 and authorize the chair to sign on necessary documents as recommended by the senior director of finance and the delegation chair.
Second.
Any discussion? Posted meter, says it all.
It's an additional, but she already got one.
She didn't
She
have
doesn't have
one,
one. She's,
so now she'll
we've
get
been
one.
like coordinating with her as far as mailings. And so this way and it'll
Have
be,
some autonomy.
we'll have more exact postage amounts, because right now sometimes you do the estimate and then, things change between and the post office has been making her actually put stamps on. Not giving her labels, actually doing stamps, and so oftentimes it's excess postage. So this will also reduce
you do
postage
exact postage
costs
with
self
the machine.
mailing.
Now that stamps
That'd be
are
more
like
convenient.
72 cents a stamp, the postage meter will be valuable and give her autonomy. Okay. On the motion, Commissioner Godu,
Yes.
Commissioner Tombrilla, and I vote yes. Now, get your vocal cords ready. Commissioner Tombrello, we're entering into open enrollment, series of, motions relative to the health insurance plan. So take it away.
All right, motion number one to delegate the open enrollment period of the plan for year one, July 1, 2025 through June 30th of 2026 as May 19th. In May,
Through that,
as May 19th, 2025 through as, it's probably wrong, right?
so we're designating the open enrollment period for the upcoming fiscal year from May 19th, 2025 through
Yeah.
June 19th, 2025.
So you
Second. I think.
No, just, when you read it.
Yeah, I know.
It kind of caught me like.
I know because it's proper, but it's sort of,
Not common.
yeah. Okay, any discussion? It's common. Commissioner Tombrilla,
Yes.
Commissioner Godu,
Yes.
and I vote yes. Motion to,
To designate, completing the fiscal year 2026 online open enrollment as mandatory for all eligible staff, ensuring that each employee acknowledges the premium rates for the benefits they have selected.
Second.
any discussion? On the motion, this is Commissioner Tombrilla.
Yes.
Commissioner Godu.
Yes.
And I vote yes. Now we have health, dental, HSA retiree, health and buyout program plan details and administrators.
Motion to approve the July 1st, 2025 through June 30th, 2026. Benefits as noted below, and authorize the chair to sign all related documents as recommended by Gallagher Benefit Services and the Senior Director of Human Resources specifically. Am I reading all that?
Yeah.
To approve Cigna continue as the administrator for medical insurance for a 1% increase in the administrative fees for the plan. No change to the plan design. Cigna wellness dollars confirmed at $25,000. To approve an increase of 3% to premiums for the HDHP 10% and the HDHP 20% plans. To approve the following changes for Cigna OAP plan. To approve the 7/1/2025 to 6/30/2026 retiree premium rate for the Cigna Medicare supplement plan. Continue with a 3% increase. The plan is 100% retiree paid. To approve Northeast Delta Dental. Continue as administrator for the insurance, but no increase to the administrative fee and no change to the plan design. To approve a 2% increase to the dental high plan premium and no increase to the dental low plan. To approve county funding for employee health services accounts like HSA, $3,500 for two-person family and $1,750 for individuals. These amounts will be prorated for employees enrolled by changing plan tiers with an effective date of July 1st, 2025. And to approve Harlow continue as the product administrator for the healthcare shopping service available to Cigna Health Plan participants, but no increase in the premiums. And the current rate holds expires on June 30th of 2026.
Commissioner, I point out that you missed one item where it says option 2, start with discontinue.
Yeah,
That needs to be also entered into our
so
motion.
this is the part that we.
Oh.
To discontinue.
Option, I'll go back to option 2, discontinue the Cigna OAP plan movement of all covered members to 1 or 2 HDHP plan options based on the enrollee's choice.
Now I'll second that motion.
Oh, we're still going.
Oh, there's more?
I was
Oh, there's a second page,
Yeah.
sorry.
To approve AM Wins continue as the product administrator for the United American Plan F and RX plans offered to Medicare eligible retirees and approximate 9.8% increase for the plan. F rates and authorize the Senior Director of Human Resources to sign the AM Wins renewal form. These plans are 100% retiree paid. To approve $1,500 annually for the employee health buyout auction for the fiscal year of July 1st, 2025 to June 30th of 2026. The full-time monthly rate of $125 is prorated for part-time employees. The same eligibility policy and procedures practice for the practice for 7/1/2024 to 6/30/2025. Plan will be applied from 7/1/2025 to 6/30/2026 plan year. And additionally, we affirm that the medical and dental eligibility and reduction policy and procedures continue so employees are eligible for and pay for both health and dental on the same dates.
Second.
Good job, Commissioner Tom. Any discussion?
I don't know, did Kathy, is this one that Kathy's asked a question on?
So just to,
Here.
she's not, but I will talk, I can speak to this.
I just wanted to, I didn't want to pass it and have her, I don't see her on, I know she's doing something, but somebody knows a little more.
I know it's gone.
Yeah, do you want to go?
So this plan that we've on the motion on the floor is to discontinue what we're calling the Cigna OAP plan. We told people last year that we were going to discontinue this. And then Gallagher came in and painted a rosier picture than we expected, so there was some consideration that we were gonna let it grandfather longer, but with some of the discussion I had with Kathy, and she agrees with this, to just simply discontinue this plan because it's not in the best interest of the county, and the other two plans are excellent, and still provide all the services we need, and it includes a health savings account that helps with the deductible that's being provided. So the idea of discontinuing this plan satisfies Kathy Stacy's concern with communication.
Mostly overall, we, as a county, looked at the plan options, and there are a couple things happening. One, shocking to no one, plans are getting more expensive. We also have, pressures with respect to, not that, but stop loss has grown substantially for us. Anyone who tuned in, or if you didn't tune in to you weren't to Gallagher's presentation last week, you can watch it on recordings for, while you're making dinner.
In case you have insomnia.
But what we agreed to last year, given the plan constraints that and the cost changes, that the most effective way to contain costs but still offer a high level of service as well as like a rich plan was to eliminate that third plan, and that was the OAP plan. So we still have two options for high deductible healthcare plans. They're rich in and of itself, and they I think what we felt is, when I looked at it, it would meet the needs. And what we don't want to do is lose the, have plans that get watered down so that they don't meet the needs of our staff. And under these plans, I think we feel good that they meet the needs. We have the HSA contributions and things like that. So that moving forward, this is as an economical component. So it's like we can maintain the other plans more robustly, and also it's sort of consistent with what our objectives were looking at this prospectively last year, which was to sunset that plan and move forward with this.
Agreed.
Okay. There was a lot of information, most of it, what we're seeing, just for anybody who's listening to this down the road, were largely the plans are not changing all that much. That's even though there's a lot of language that is like, what does all that mean? There are modest changes, and but for the most part, services will remain largely the same. Anything else? Okay, on the motion, Commissioner Godu?
Yes.
Commissioner Tombrello?
Yes.
And I vote yes. Now we have the stop loss renewal.
I'll make a motion to approve the stop loss revised renewal status for option remaining with HM as the carrier for 12 months, period from 7/1/2025 to 6/30/2026 for $170,000 deductible, and a policy basis of 72 to 12 with a 45.1% increase in the rate and a 50% rate cap as recommended by Gallagher Benefits Consultants and the Senior Director of Human Resources.
Second.
Any discussion? I can,
Not for me.
we're talking about the increase of cost in insurance, and one of this big piece was the stop loss. Our stop loss has gone up tremendously, and again, if you've paid attention to, if you watched like the more thorough discussion with Gallagher, everyone can see 45.1% increase in rate. That is obviously a significant increase, and part of the reason we've made the decision to remain with HM is because they have been providing stop loss for a while, and in fact was a very competitive rate, and how we feel is best for the county going forward, while still protecting us because we are self-insured.
Good.
On the motion, Commissioner Tombrello.
Yes.
Commissioner Godu?
Yes.
And I vote yes. voluntary benefits, details, and administrators.
Right, motion to approve the 7-month 2025 through 6/30/2026 voluntary benefits notice. Below is authorize the senior director of human resources to sign all related renewal documents and authorize and or utilize DocuSign if vendor indicates as recommended by Gallagher Benefit Services and the senior director of human resources specifically. I'll be back again. To approve New York Life to continue as product administrator of the employer sponsored basic life insurance and basic employee AD&D insurance plans for benefit eligible employees with no change in coverage, $25,000 and no change in the rate at $4. Parentheses 0.140/1000 life and 0.02/1000 AD&D PPPM per participant per monthly fee. You guys are killing
Do
me.
you want me to take over for somebody?
I'm getting.
Because I don't mind.
Yeah, I'll be happy to help.
Yeah,
Some days you don't have good eyesight, they have good eyesight.
put me in, coach. But do you want, if you want to pass on some of the reading, we're happy to each take you can take the
You
next
gotta give
one.
it a whole guy every time.
I'm not gonna put you out of the
I'll keep
time.
it. To approve New York Life to continue as the fully insured short-term disability carrier with no change in the rate. 51 cents per $10 benefit with 100% of the costs covered by full-time employees and a prorated share for part-time employees. To approve New York Life to continue as the product administrator for voluntary long-term care, long-term disability with no increase in rates. To approve New York Life to continue as the product administrator for voluntary employee, spouse, and child life AD&D with no increases in that rate. And to approve Nationwide to continue as the product administrator for the voluntary pet insurance benefit along for payroll deductions and enrollment is on a rolling basis. To approve Living YouTube to continue as the product administrator for voluntary home and auto insurance benefit allowing for payroll deductions. Enrollment is on a rolling basis.
Next page, page 4.
To approve,
Go ahead. I believe that's the end of this motion. And the next motion is called motion 5. So I think we can.
You're
Am I
jumping
on the
to
wrong
page 5.
page?
You have to go to page 4 first,
Oh.
which is if you flip that page over, the one that to approve FOIA. Yeah, to approve, no, not that. It goes to the other page. I'll continue. To approve
Oh.
FOIA to continue as the product administrator for the flexible spending accounts FSA and cafeteria 125 plan management at an annual renewal fee of $400 payable on July 1st, 2025 for the July 1st, 2025 through June 30th, 2026 plan year. Annual non-discrimination testing fee of $400, $4.35 per participant per month fee, no increase in rates. To adopt the IRS, are you okay if I just bang through the rest of these?
I don't like those 3 letters. We can
Okay.
Do that one.
To adopt the IRS annual contribution limit of $3,300 for the medical FSA and limited use FSA and the IRA carryover limit of $660 for the July 1st, 2025 to June 30th, 2026 plan year. To authorize the Senior Director of Human Resources to sign the County of Rockingham FSA renewal form for the July 1st, 2025 through June 30th, 2026 plan year. To approve FOIA to continue as the product administrator of the health savings account, no separate fee for HSA plan account administration. To approve FOIA to continue as the product administrator of the COBRA with no increase in rates at the annual renewal fee of $250 payable on July 1st, 2025 for the July 1st, 2025 through June 30th, 2026 plan year. 45 cents per employee per month fee. Qualified beneficiary takeover fee is $40. To approve IMED to continue as the voluntary vision carrier with no increase in rate. To approve Lucid to continue as the employee assistance plan provider with no increase in rate. To approve Colonial to continue as the product administrator for the voluntary accident, hospitalization, and critical illness benefits plan with no increase in rates. Notes, Boston Mutual continues to be retained, but is closed to new enrollment.
Second. I had the easy part.
I can keep going. Any
Oh, we need
further
to vote.
discussion?
Yeah,
On the motion, Commissioner Tombrello.
Yes.
Commissioner Godu.
yes,
And I vote yes.
Mm,
Go ahead, Commissioner Tombrello, and then maybe we'll turn it to you, Commissioner Godu, for
Yeah.
the position request, unless you want.
Make a motion to approve the Medical Solutions LLC contract service agreement for an initial period of 12 months with automatic renewals for successive 12-month periods, and authorize the chair to sign all necessary documents as recommended by the Senior Director of Human Resources.
second,
Any discussion? On the motion, Commissioner Godu,
yes,
Commissioner Tombrello,
Yes.
and I vote yes. Now we have proposed fiscal year 2026 position request for facility operations, and Commissioner Godu, I'm gonna give it to you this time. We'll
right,
change it out.
there was
So,
one that
we have-
that was altered.
Yeah.
Oh, yeah, here, can I see it, and no, it's number 4.
Yeah.
Yeah, I'll just make, you want me to, actually, let me do it.
Okay, you do.
All right. Motion 1, to approve adding 1 new position, cybersecurity analyst and grade R19 effective July 27th, 2025, pending executive committee approval as recommended by the Senior Director of Human Resources. Motion 2, to approve adding 1 desktop support technician position effective July 27th, 2025, effective July 20, effective July 20, pending executive committee approval as recommended by the Senior Director of Human Resources. 3, to approve adding 2 building and grounds technician positions effective July 27th, 2025, pending executive committee approval as recommended by the Senior Director of Human Resources. To approve motion 4, to approve adding 2 new shift technician general maintenance positions, 1 effective July 27th, 2025, and 1 effective January 1st, 2025, pending executive committee approval as recommended by the Senior Director of Human Resources. Motion 5, to approve adding 1 electrician telecommunications tech position effective July 27th, 2025, pending executive committee approval as recommended by the Senior Director of Human Resources. And motion 6, to approve adding 1 HVAC general maintenance position effective July 27th, 2025, pending executive committee approval as recommended by the Senior Director of Human Resources.
Second,
I think I couldn't state, but I think on the desktop, you were gonna fund that July 6th. Excuse me.
Oh, I'm sorry,
October
that's gonna
6th,
be
And the cybersecurity, October 6th.
correct. You're
you.
completely right.
I'm just making sure, just so that we can fund it.
Did we say?
And there was a shift tech change one
But
too.
we're not teaching anyone.
Okay, good,
Yeah.
thank you. All right.
That was the one. So yes, I'd like to amend motions 1 and 2 to reflect a effective date of October 6th, 2025.
both,
Oh, to both the, yep.
Yep.
Okay, thank you, Allison.
No, okay.
that's part of our budget consideration.
Yes, so, did you second both motions?
Second, yeah,
Okay, for, discussion.
Are these all in the budget, Chuck?
Yes.
All in.
Yes, but under the Board of Commissioners, proposal, they're going to be, the amounts will be changing.
Correct.
So they are all in the department proposed budget.
Yeah.
But now they're gonna be changed as far as dollar.
And because what we did within that budget discussion was we're delaying some of the start dates so that we can sort of reduce some of the costs in the overall department budget. In light of the fact that largely these positions are a product of needing to staff the new building. And this is the maintenance and operations of that new building. And
agreed. This is about the new building, these positions. We're not just adding positions.
yes, this is not a new position. This is, we've
We have
built
a new
this
building.
new building and
Gotta
now we
keep it.
need to make sure we maintain it properly. Commissioner Godu,
Yes,
Commissioner
Yes.
Tombrello, and I vote yes. Go, Commissioner Tombrello, you're,
Motion to approve to repurpose, retitle, regrade as 1 victim witness specialist position. Grade R12 to 1 victim witness program coordinator. Grade R15 effective July 27, 2025. Pending executive committee approval as recommended by the Senior Director of Human Resources.
second,
would it make sense to table this in light of ongoing discussions?
Oh,
Per week?
this is, giving a raise to somebody,
Correct.
is what it looks like to me. And I'm not real familiar with the details.
So what's happening is they have the victim witness specialist. And they're taking one of those positions and elevating it to a coordinator so that person can coordinate the other victim witnesses and provide support, training and education to them. So it's not just it's a promotion and it's elevating that position.
I guess, Pat, I could turn it to you and say, would you rather us wait as we look at everything as a whole? Or would you rather,
Is this gonna happen anyway?
So
Or is this budget?
I can tell you after our meeting this morning, we came back and we're still looking at things, but what we did talk about is we're firm on requesting this regrade.
okay,
So that's something we're sure about. We'd like to move forward on that and not necessarily wait until you firm up the budget.
Okay. In that case, let's vote on it.
okay. On the motion, Commissioner Tombrello, Commissioner Godu?
Yes.
And I vote yes.
Thank you.
Proposed fiscal year 2025 Q3 position and title changes in assisted living.
Make a motion to approve a title change from wellness manager to the director of resident care. Revised job description and regrade from an R20 to an R22. Effective May 18, 2025, pending executive committee approval as recommended by the senior director of human resources. Another motion to approve a title change from the assistant wellness manager to the assistant resident care manager effective May 18, 2025, as recommended by the senior director of human resources. A motion to approve a title change from wellness coordinator to residential care coordinator effective May 18, 2025, as recommended by the senior director of human resources, and a motion to approve a title change from the wellness supervisor to resident care supervisor effective May 18, 2025, as recommended by the senior director of human resources.
Second.
Discussion.
Go
ahead.
The first motion to make it effective in May 18th, how does that happen without us getting through the executive committee?
Because the executive committee meeting is on May 9th, so we're bringing it before May 9th.
Oh,
And then,
They would be approving it and then it takes effect after that in the first pay period.
retro,
No, it won't be
But
it's
retro.
gonna have to go all the way back.
It's not, it's effective May 18th. Not going, there's no retro, it's prospective.
and what is the fiscal impact? I think
It's actually, so
yeah,
the position is essentially the equivalent of the DON for the building, who, because of the position is currently hourly. They're also receiving shift diffs, they're receiving holiday pay, they're receiving overtime, they're receiving on-call. And so it's it's to align to both kind of what the job scope is, but then the compensation, although there's an increase for the grade, it's actually a positive kind of piece for us in that we have more control over the line and some of those additional
so
pieces. So
Should
there's
help
not
them.
a negative impact fiscally.
it might help manage overtime.
It also, it falls in line with the Field Labor Standards Act for the position, so I don't like to talk about it, enough and not saving money.
Sorry. Okay,
Okay, well,
We just wanna follow in line with that.
okay,
So usually when somebody is a title change, you see a raise, they go to- so this is just.
this is just a title change.
The title changes just to help kind of align with some of the things that we're finding when we're trying to recruit is that it doesn't know that it's the nurse versus an LNA and trying to kind of help on that side. But then also when we're talking and communicating with hospitals and family, wellness is kind of used through multiple levels, including like our life enrichment department, as well as our nurses and LNAs, and really wanting it to be that they're the ones driving the resident care of it and to help from a standpoint.
Great, thanks.
Thank you.
On the motion, Commissioner Godu,
Yes.
Commissioner Tombrello, and I vote yes. Okay, now we have a proposed position change for the Department of Corrections.
I'll make a motion to approve a regrade of the inmate services and programming manager position from a R18 to an R20 effective July 27, 2025, pending executive committee approval as recommended by the senior director of human resources.
Second,
Discussion?
and can you give us a little insight on what that is?
So it's the clinicians, those people that do behavioral health and stuff like that, substance abuse and all of that. This position oversees all of that. I've been watching that over the last 4 to 5 years, trending on what that looks like out in the market. And this position is so marketably under the Bureau of Labor Statistics. So I have to make sure when we're doing the collective bargaining agreements, and we just came out of that with those mental health sub people that are under that CBA. This person needs to be reevaluating market analysis, and it puts them in alignment for where they should be. But he's not gonna get a person with the wage rate that is now. If this person left, we wouldn't be able to find something.
And this person has to oversee other people's licensures. And the one is the only person that can, so they can do their hours and those kinds of things. Is in charge of that department.
Is this an unfilled position currently?
No.
That's somebody that we have, that we're happy with, and, okay. That's good,
Okay. On the motion, Commissioner Tombrello.
Yes.
Commissioner Godu.
yes.
And I vote yes. And then we have a regrade with respect to the finance office.
I'll make a motion to approve the regrade for the senior director of finance position from an R27 to an R29. Effective May 18, 2025, pending executive committee approval as recommended by the senior director of human resources.
Second,
Discussion. We've discussed this.
we've discussed it, I'm very happy to make the change,
On the motion, Commissioner Godu,
yes.
Commissioner Tombrello, and I vote yes. Now we're moving on to long-term care services. We have the Northeast Mobile Dental Services PLC agreement.
I make a motion to approve the Northeast Mobile Dental Services PLC service agreement for the period beginning May 1st, 2025, ending September 31st, 2025, and authorize the chair to sign all necessary documents as recommended by the senior director of long-term care.
So,
Second,
oh, I thought do we need, and this has a big,
There's
a bid right there.
there's now one.
So, I'm gonna make another motion in conjunction with that, which is, I move to approve the Northeast Dental, Dental Services PLLC, proposal and bid request in the amount of, for a period of, no more than, 8 months for, amount not to exceed $24,000. And authorize, this is beginning, beginning, on signing, and authorize the chair to sign all necessary documents as recommended by the senior director of long-term care services.
Thank you.
So, we have two motions on the floor. One is the bid waiver request, and the second is the actual service agreement.
If I may explain.
So,
we skip one,
so what we're going to go, so this is all with respect to A, which is there are two motions with respect to the Northeast Mobile Dental Service
the
PLC.
one you read and the one that's written down.
Correct.
Okay.
There's the bid waiver request and then the actual service agreement. So, they're in tandem because first would be the bid waiver request and then approving the contract. But now we open it up for discussion, and Chantel, would you like to?
So if I may, I apologize. The bid waiver didn't cross my mind until just the beginning of this meeting. So thank you, Elaine and Chuck. So essentially, our dentist who's been with us for many, many years is retiring, and we've been working on trying to find a replacement. We have an open RFP process. We have sent the RFP. Elaine, as always, did a lot of research, sending it out to as many people as possible. There's not a lot of dentists for nursing homes, but there's requirements around dental for us from a regulatory standpoint. Northeast Mobile Dental has agreed to do a temporary kind of contract to keep us compliant for the time being while we go through the RFP process because of a regulatory piece. But the RFP is open, we just haven't been able to finalize it, and this is to keep us in a regulatory compliance.
all good. What are these for?
Those were just ours, so you can review it.
Oh,
Okay, so do we have one that we're signing
I think
this
it's
for
right
the
there.
bid waiver? Oh,
Yes,
okay,
okay.
all right, very good.
So with respect to the bid waiver on the motion, Commissioner Tombrilla.
yes,
Commissioner Godu.
Yes,
And I vote yes. With respect to the service agreement on that motion, Commissioner Godu.
yes.
Commissioner Tombrilla.
yes.
And I vote yes.
Thank you.
I'd like to point out that, above number 6, there's a letter K, says proposed fiscal year 2026 pay plans discussion. Do we have some detail on that?
I need that. It's a lot of moving parts
Oh, plenty.
today.
So, who's
We're-
you're gonna
we're
lead this discussion?
And I will.
Okay.
Each year, we look at, we look at the budget, but we also look at the scenarios for how much the non-union employees will get. The goal that we have that was put in place for our cost of living based on our job and salary classification study was to use the CPI, and that's for Boston, Cambridge, Newton. Chuck took it a step further and is using the COLA by utilizing the CPA for a 10-year look back, and we've done that successfully for the last 3 or 4 years. This year average will be 3.06%. And then Chuck has crafted a printout of scenarios related to just the COLA and any kind of scenario above the COLA for an annual evaluation percent. And Chuck, do you have those?
Yeah.
I think we got this on hand. Or not this exact.
It's in the.
Oh, I think it's in your
Budget
budget.
volume.
Same budget.
Yeah, okay,
Yeah.
right. But, so
I don't know if it's-
my feeling is that, thank you for doing the work to generate all this. We appreciate it. I think we need to finish our discussion with all the department heads and then in conjunction, then maybe that would be the time for us to discuss it a little further in terms of where everyone's coming in from budget and look at, I'd like to see the whole before we sort of into fiscal impacts a little bit before we choose a scenario, if you will. Is that?
That's fine, but I'll just share that I'm leaning towards a total of 4% increase. That seems to be our theme with this year's budget to keep things under control, so that would be a 1% valuation increase. But
Plus
I guess that's just where my thoughts are right at the moment. We can discuss it, and I agree. We should be looking at the whole budget as we're doing this, but
You're saying 1% here, like COLA plus
COLA plus 1
one, okay,
is what I'm suggesting.
yeah.
Because that would be consistent. We're talking about the new,
6%.
higher, the non-union raises, because. And I'm suggesting that we do COLA plus 1, which brings it to like 4.06%. Which is consistent with what we've been doing with all of the department heads and, with the budget, but. Kate's suggesting that we should probably before we make a decision, we should look at the entire budget and review this again. And I agree with her.
You know what I would like to see is I'd like to see like some numbers check, all the non-union, what 4, 5, and 6 does to the budget. Oh, but yeah.
That is it.
It's right here.
I knew when I was up that I heard that printer going out.
In fact, you have 0.25%.
Right,
Oh, you gave us this morning.
yes.
Yeah,
We are-
there's 14 different.
I'd like to look at it and see, and I think we need to see the budget.
I agree, I don't, but I think we need to, out of, courtesy, go through the rest of our budget meetings. And then go from there to talk about that, where we can, where we think is reasonable in light of all the considerations. All right, does anybody have further?
No, that was just a discussion anyway, so that's good.
The rationale. But Okay, so thank you, Commissioner Godu, for highlighting that. We had missed that, or I had missed that, I should say. Next, we have a bid waiver request for Power DMS by Neoga.
I'd make a motion to approve the NeoGov proposal on bid waiver and request an amount of $33,670.73 for the Power DMS platform for the use of long-term care policies for the term beginning April 7, 2025 through September 6, 2027, and authorize the chair to sign all necessary documents as recommended by the senior director of long-term care services.
Second.
Discussion. Chantal, do you want to share about what
Sure.
the benefits of NeoGov?
Yeah, so there's a few kind of, some of the goals that we've had is wanting to have transparency with our policies and have them accessible. So this is putting them in electronic format opposed to binders. It also will log on kind of the behind the scenes for us as we're updating policies, be able to push them out, and some of the regulatory requirements, being able to show kind of the interdisciplinary team, including our medical director around policies, that'll log all of those. In NeoGov, we looked at many sites, all have wonderful pieces. NeoGov, we already have contracts through Human Resources for. In addition, we utilize a company called MedPass that is kind of the basis of our policies. And NeoGov kind of has the sole source for them to auto filter for us to, or input for us to edit. So the vast majority of our policies, we won't have to be hand typing in from an efficiency and a standing time. So once, if we're able to move forward with this, we would be moving to get all of our policies in an electronic format. So any of our staff can on a computer, click an icon and pull up whatever the policy is to ensure that we're doing care and implementing care while also documenting for us to assure that we're monitoring and updating our policies in accordance with regulatory changes, practice changes, and kind of CDC alignment.
Fantastic. I mean, putting this to it, I like the idea that we're moving electronically for both. And you know, I know Allison, it's nice to hear that you're already using NeoGov, because if we make decisions, you know, I think this is the platform that we should be using to move forward as we try to move towards countywide policy, electronic policy access. Just sort of the future. So seems like we're using NeoGov here in terms of the bid waiver request. It seems like it makes sense because they're the biggest game in town for purposes of trying to centralize policies for the county going forward.
They're the only game in town too, really.
There's
Yeah.
a few that have them attached to different education sites. I think one of the pieces with it is when we looked at it, we tried to take into account kind of the longevity of it to spend. It's not going to be a 1 month process to get it up and running. It's a very heavy lift as we build it out. And what we didn't want to do was price ourselves out so that once we, 6 months from now, 7 months from now, when we've put all the policies in and built it out, we can't sustain it from a cost standpoint because it's tied to an education and kind of locking us into our education kind of sites at the same time, where most of the other ones are tied to an education platform. So it locks you into the education platform in order to kind of use those components at the same time. This one being separate allows us to still meet the needs and aligns with a program we're already familiar with. It gives the ability from an efficiency standpoint. And there's a way that should it expand that you can edit accesses so that, let's say, a lot of ours kind of crossover, so it's probably the worst example, but we could filter it. So if someone on Jude's team was going into policies, they wouldn't have to kind of filter through all of long-term care. But then it doesn't kind of hold us in a standing pattern that as our electronic education platforms, which most of them are tied to, that we wouldn't be able to pivot as those prices continue to fluctuate as well, with them being tied together, I guess.
Great. Okay, on the motion, Commissioner Tombrello.
Yes.
Commissioner Godu.
Yes.
And I vote yes.
Thank you.
Okay, right on to department head updates. Chuck, lead us off.
Budgets, grants, quarterly reporting, I know it's, you know, April, but keep in mind that the executive committee meeting is May 9th. So that, second Friday in May, as far as the quarter ending 3/31. Also be mindful that, there, you know, if you're a division director, you might start getting outreach from your subcommittee chairs as far as trying to arrange, subcommittee meetings as far as coming up as well. So some might be scheduling them, even for like the last week in April. So don't be surprised if that starts happening. I think it already is. Sometimes if they propose are earlier than even the commissioner's budget would be going out. But, I think when that's already been corrected. Also, I know that tomorrow for, those departmental individuals involved, we are asking that departments give us updates as far as projected expenses through 6/30. Obviously, if your department wants some assistance, I'm sure that Katie Casey or another individual in my office can maybe help project out some of those expenses. Obviously, only worry about your operating expenses. Do not worry about your payroll benefits or payroll expenses like FICA and retirement. I'll take care of those. Again, just continue to be very busy trying to track all the federal and state changes. Continue to keep an eye on what's going on in Concord. I think I'll have some quality time coming up there. I do have the County State Finance Commission meeting for next Wednesday. We'll discuss about DHHS matters that are important to both the county and the state. So again, really busy overall.
Thank you, Chuck. I know it's like a long, busy day for you and Allison. So Allison, take it away next.
It's just been budget, some of the regrades and repurposed positions, and just we're into full blown for our side of the house now on open enrollment. We have to update our software platform and get all the contracts signed and stuff like that. So that's where we're at right now.
Thank you, Allison. Jude.
Good afternoon. All's well in facilities. I have nothing new to report. We're also very busy. I will tell you the sidewalk
Yeah.
issue with the state of New Hampshire DOT was resolved last week. There was a bit of confusion that they sent an email to the engineering firm saying, okay, we're good to go. So I was happy about that. They gave, there's a couple of forms that we need to have signed, but it's the same stuff that you've already voted on.
That's
Other than that, the rooftop units for this building were delivered today for just over one.
That's why the crane was here.
That's why the crane was here. They have a couple more pieces to move tomorrow, so rather than have them unload and reload, we did tell them they could have the spaces for the day, so. We'll get them out of there as soon as we can. We're still working on the control side, so the graphics aren't ready. We're not ready to fire them up, but it's exciting just to have them on the roof. So
Absolutely.
we're making progress for sure.
Thank you. Jason?
We were at 137 this morning, been working on budget. The open abatement, we got moved to actually this coming Monday for a meeting, so I'll have more information there. I did have a board of trustees meeting for retirement system. Obviously, there's a lot of scramble there, kind of figure out what it would look like if some of these things go through the legislator, you know, like the other. There was a third retirement that was outside the retirement system that might have some ramifications. If they put money in and it goes back to fix the 1,800 people that were now 1,500 left, that could have ramifications. So it's just a lot of speculation what's going to happen on that end. Bill 511, which is a bill that was put in for about the jails to take ICE detainees when they're arrested. We put an amendment into it to say we hold to 48 hours. Well, 48 hours and only for those that have contracts with ICE, including contracts that have medical, but that was removed today. So if it passes through the way it is, we have to take them as they're arrested, and we paid for the medical, we paid forever. So there's some issues on that. We have funded mandate.
Yeah.
They want to accept our proposal on that. Just don't know how that's gonna go or where it's gonna shake out towards the end, but we're definitely keeping an eye on it, definitely trying to work through it. That's it.
That was at the legislature?
Yeah.
House?
Yes.
Can't tell. We're out of masks. Tell us more good news.
Yeah. So for census, the nursing home's at 130, the assisted living's at 47, with the 2 beds that are available already have planned move-ins into them. We are out of outbreak, number one. So there's still some cases. We do have 1 staff, however, it's not affiliated with us and they haven't worked, so it hasn't impacted us in this time frame. So that's exciting. No masks for the time being. And then some just general spend budgeting. We have the new regulations that go into effect at the end of this month, so kind of working around some of those processes. Then we had mock survey a couple weeks ago, so working on compliance around that. We had our Med B audit last week and it went beautifully. There was a few recommendations, but they were more just system things from an efficiency standpoint. So that was very exciting for us. Thanks to JJ and the ladies at MGS. They really carried the team in getting those pieces together, but it was a really nice
Come a long way.
conclusion, I guess, of the audit.
Yeah.
And then other than that, it has really been kind of budgeting the RFP dietary contract, and
Yeah.
working through those.
I read, it was 40, that contract was 46 pages.
Yeah.
But
It was,
Chantel team pointed out some things. There wasn't actually, nothing actually written for corrections.
Yeah.
So he used to say, it's giving Eileen a bunch of stuff to go back that they won't put back in there or in there to begin with. I hold them accountable, like LUPA for religious stuff.
I was just
or
gonna, I said, yeah.
That I
like
circled
religious
that,
meals.
it's the HC stuff. Part of it they didn't have in there. They're gonna deliver meals 7 days a week, for breakfast.
Also going in for. to
going
do
in for,
some
I highlight that
good
again,
tea.
going in.
I
They
said-
told me that they would come in and do
Yeah.
inspections, but it's not in there, so there's probably a dozen, a little over a dozen things I circled, said that they need to, we had conversation with that, they said was gonna be in there, so I'm expecting that.
So I do know, not to cut you off, Elaine, as always, saves the day, has already read through it, turned it into a Word doc, has compiled with comments, all of your feedback, which thank you very much. My feedback, I know that she pulled different things from the RFP that was able to be sent over to Jason to kind of see like what's the important pieces with everything on everyone's plate. They're kind of her, I think, to kind of support some of those pieces. She caught a few things and kind of compiling it, and then we have been having open conversations with them around the implementation. I know there was a financial call that Chuck was part of around it. I know
Yeah.
Allison has touched base with kind of the HR team, so things are still moving. But it's a much larger contract, which is kind of what we said we wanted to begin with, to kind of have that clear who's responsible for what from an accountability standpoint too.
I
So,
think our last contract was like 2 pages.
yeah, I think we're going from like 5 pages to 40
Yeah.
something right now. So
Good.
it's definitely different, but
Thorough.
it's nice because it will have some of those clear cut, you know, this person's responsible for this, and allow from an accountability and like a system standpoint.
And KPIs. also.
Yeah. So it's a lot, but it's exciting. So those have kind of been the time constraint things for us.
Great.
That's all I have for her. And thanks again to Molly. She really has been wonderful.
Excellent.
I'll tell her.
All right, Pat. Nice to see you again.
Yep. Hi, everybody. We're really busy here. I don't really have much else to report, so have a good day. Thanks.
Chuck. Sheriff? Oh, you're on mute, Sheriff.
Yeah, can you hear me?
We can hear you now.
Nothing new to report. Thank you.
I see a few other. Aaron or Rich, either of you guys want to speak? No? Okay, I think, Leila, do you have any?
Yeah.
Yeah. Well,
Thank you.
Well,
Actually, I was sent these to Nixo contract to Attorney Bedard on Monday, and he just answered my email. He wants to know if you would love to meet with him regarding the contract
Which
or.
contract?
This is the desk, so,
Contract.
I
I
think,
don't think that we need to meet in person right at the moment, or even not till after we finalize that we're satisfied with.
but
He's
maybe,
got a bunch of stuff to add in and.
maybe it makes sense
We
to.
already awarded it.
But maybe at this point, it makes sense to, for your team to talk to him if there's anything. I mean, I don't know what.
I think if, are they coming in or anything relatively soon?
They being whom.
Sodexo?
I think until the contract is finalized, those are the steps that have to be done in order to do that. But I mean, I'm happy not to do for you, but you know, to do it, and I'm happy to take minutes. And if there's something that needs to be passed on, I'm comfortable doing that. And so I'm sure you are.
And I would also suggest that once you're satisfied with the language in the Sodexo contract, that it gets looked at by Prime Care.
It's already gone through
Primex.
Primex as is.
Primex, right?
Yeah, so it has gone through. I think the kind of assumption is once everything was finalized, we'd do another pass through, but we initially, because of the time constraints and wanting there to be no barriers. The second it came through, it was immediately sent off because of just the importance of it, the
Timing.
size of
So
it. the
Primex
timing.
has looked at it?
Yeah.
Oh, okay.
Yeah.
So the
All right.
technical stuff has actually gone through Primex, the stuff like that, I don't know what I'm adding in these things like, you know.
Accountability.
Accountability.
Meals and those
Just
kinds of things,
cleaning
so
the
when,
kitchenette.
yeah, for me, it wouldn't be anything that
Primex
would
wouldn't
have
care
to.
about, right?
And then I believe that Robin has already looked at the cyber and kind of those
Oh, yeah.
components as well.
I'm happy to also sit on the call with, Attorney Bernard if that's something, or no, or it could be stable, which is fine too.
Okay.
All right. Next we have, oh, sorry, what else, Leila, did you have anything else? I'm sorry.
Thank you.
It's a long day. Okay, we have some new business, old business, and first we have a walk-in for an inmate administrative transfer.
I'll make a motion to approve an inmate administrative transfer pursuant to New Hampshire RSA 30-B:21 dated April 8th, 2025, transferring one inmate to Carroll County, one inmate to Stratford County, and one inmate to Grafton County as recommended by Superintendent of the jail.
Second,
On the motion, Commissioner Godu,
yes.
Commissioner Tombrilla, and I vote yes. Does anybody else have any other new business?
Nope.
Okay, the only other new business or discussion I want to have is just that we know everybody's coming in for budget review. As part of that process, some departments have elected to go back, look at their budgets and then come back to us. I think what we would ask is after, you know, we have all met, if you're gonna make changes to make you know, either discuss or propose changes to your budget and then submit them electronically. We're gonna review everything and then you can say, listen, we'll take a look at the budget, everybody's budget again, and then either have a second meeting, you can request a second meeting, you don't need to request a second meeting, or, you know, some people obviously don't.
If you want us to actually submit another budget that's closed, or that you get today, and you're gonna shave it off, how do you want to do that?
Well, Chuck, one way or another, needs to receive
Yeah,
all of the changes
We're locked
clearly.
down, so I didn't know.
Yes. So if you're locked down, so what I think is this, if during your meeting, you resolved your budget, you can propose, to Chuck, is that okay? And
Yeah.
then Chuck will update those and those are complete.
So you send it to him by email or something.
If you, for those who have not finalized their numbers, if you will, then you can send your draft to us, right? You with your, or just if you want to just, instead of doing a full budget, just the changes that you intend to make, it can be on a Word document, it can be however you want to orient it. It doesn't have to be like specifically typing in line items. And then we'll look at it and then figure out from there, we'll email to coordinate either another meeting or not. Does that make sense to everybody? Doesn't?
Yeah, and I'll just add, if there's any changes that involve personnel, then what I will do is I'll prepare like a VOC version of the payroll projections for the department. And I'll share them back out to the departments, just so you guys can take a look at them as well. And then also I'll communicate or send those initial VOC payroll projections to the board as well.
Great.
So.
Do you think that satisfies what we were talking about?
And Chuck is gonna recompile the budget after department heads have made cuts that we've requested.
But if there's people who are making, who haven't, we're gonna take a second look at, you don't necessarily have to put it into this budget spreadsheet. You can just submit a document, 1-page Word document with your changes.
Right.
That only will trust me, see that.
That way, Chuck's in.
That's four when you go,
Right,
and then if we pick one, and get back to where we want. Put it in there. and let them know.
Right, so all the changes basically become the first draft of the board proposed budget. That's basically what's gonna happen, and there'll be a separate column next to the department proposed. That you'll have,
correct.
that's what will happen.
Okay.
Great. Moving on to public comment. I see someone named Sam Crawford. Do you wish to speak?
No, ma'am, I'm good. Thank you so much.
Okay. Thanks for joining us today. With that, that concludes our public meeting, and now we're going to enter into non-public sessions. So I will take a motion to enter into non-public.
I'll make a motion, we're going to non-public and RSA 91-3:3, Roman numeral 2, M and A. M being minutes of non-public session, A being personnel.
Second.
Any discussion? On it, Commissioner Godu,
Yes.
Commissioner Tombrello,
Yes.
and I vote yes. Thank you, everybody.
I give the projection, share back.
It's just a quick question for Michael. So
Hello, everyone. We were in non-public and we're back in public session. We had 3 non-public sessions. And I'll turn it to Commissioner Tombrello to make some motions with respect to the non-public sessions.
I will make a motion to seal the non-public minutes. We had 3 items. Number 1, until July 1st. Number 2, indefinitely, and number 3, indefinitely.
And the rationale behind that.
No, would be number 1, affect adversely the reputation of any person other than a member of this board. And
I think the first
Number 1
one,
was personnel.
I think with respect to the
Yeah.
first session, it could be categorized as either 1 personnel or 2 render a proposed action ineffective. And with respect to 2 and 3, 2 is with respect to it could add divulgence of the information for number 2 could adversely affect the reputation of a member other than this board. And with respect to 3, it could affect adversely render proposed action ineffective.
Agreed. I'll second that.
Okay, on the motion, Commissioner Tombrello.
yes,
Commissioner Godu.
Yes.
And I vote yes. So, I think we will adjourn this portion of the meeting now, and then we are going to reopen the public, session for the budgets. So I will take a motion to adjourn.
Second.
On the motion, Commissioner Godu.
Yes.
Commissioner Tombrello.
Yes.
And I vote yes. Thank you, everybody.